Welcome to another episode of Sex with Ashley. I'm your host, Sex with Ashley, and today we are talking about designer vaginas. Yes, we are talking with a doctor who specializes in designing women's vaginas to be whatever they want to be. All right, so let's get into it. So today we have Dr. Michael Reed. Hi, Dr. Reed.
Hi, how are you?
I am good. How are you?
Hey, I'm just really excited to be here. I'm always excited to discuss what I do, how it changes the landscape for women, and I'm just real passionate about it. I'm ready to talk. I'm ready to shine. I'm ready to share. So I hope everybody is ready for some good listening. I've been a gynecologist, OBGYN now for 25 years. I've on the last 5+ years, I focus and hone strictly on cosmesis and cosmetic gynecology.
Okay, so what do women come to you for? Like, what is the most common reasons women will come to see you?
Yeah, so I think there's a couple of things. So cosmetic gynecology, I want to back up just a minute. Cosmetic
Okay.
gynecology, right? A lot of people, they're thrown off by that word,
Okay.
cosmetic in front of gynecology. It's on
Okay.
purpose. It's on
Okay.
purpose. I want you to say, well, what is it? What cosmetic? What are they doing? That
Right.
don't make sense. People shouldn't be doing things. So cosmetic gynecology, another way of saying it is functional gynecology, right? So in Western medicine, we focus on disease and stopping out disease. If you think about cosmetic gynecology, we're actually like warriors for women when it comes to their sexual health. So what does that mean is that we've gotten more education. We're trying to help women thrive rather than just survive, right? So I will see women that have to deal with lichen sclerosis and having to work in and around the clitoris because the clitoris can be covered and not be able to experience pleasure. So we have extra surgery, we've done extra training, we can work in and around the clitoris. We may deal with women that have issues with painful intercourse. Well, a lot of times the physicians, I was one of them, OBGYN, we're not trained how to manage a lot of painful sex. In fact, we don't even talk about sex in general when we go to an OBGYN's office. And so a cosmetic gynecology focuses on pleasure. It focuses on the ability to thrive. We focus on ameliorating painful sexual intercourse. We also do other things that work on pleasure as far as vaginal tightening. Vaginal tightening is important for a woman as far as her ability to experience pleasure. So for a woman, pleasure is directly related to the amount of friction that is generated. So if she can have more tightness and feel her partner more, then she'll generate more friction and thus she'll have greater pleasure.
So,
Go ahead.
so let's talk about the tightness, vaginal tightness procedure. Because I've heard of women getting that done. So what exactly is that? So what happens how do you make it tighter?
Yeah, so there's 3 steps to the vaginoplasty or vaginal tightening procedure. So the muscles, if we're looking at the pelvic floor, the muscles should be together. The muscles separate from the baby trying to come down and out of the vagina. It needs to make room so the muscles separate, pelvic floor relaxes so the baby can come out. Well, when that separation of the muscles occurs, you can get a rectocele, and that's where you get a hernia of the intestine that shows up as a bulge or a lot of pink in the vagina. The other thing the woman will experience is less friction. She may not have that coital squeeze that she would like to have when she's ready to have it, she's not feeling her partner like she wants to. She's not feeling it on the way in the way that she wants to. As far as men, we're just happy to be there. We don't care about that part. We just want to be
Right.
there. So we're like, what are you
Okay.
doing? Why are you doing
Right.
these procedures? It doesn't make any sense. So the 3 steps. So the first one we do is that we open the skin of the vagina so that we can get to the muscles, and we bring the muscles of the vagina together. Then we remove excess vaginal epithelium. We come to the outside of the vagina, which we call the vulva. Back up, make it a little bit. So we've tightened the inside by the way that I described it, bringing the muscles back together. Then what we do is we want to recreate the perineum so that it's more supported and together. I have a better diagram for that. So this is what we call the gaping vagina, more open in a sense, and that's because these muscles were injured of the perineum. So you have transverse perineum, puborectalis, and behind the labia majora is the bulbospongiosus. So we bring all these muscles together, bringing everything back together, rebuilding this so that you have more support and you can squeeze when you want to. So we cosmetically repair it. So those are the three things. We bring the muscles together, rid yourself of the hernia, and cosmetically repair the outside to some semblance of how it was before you had children.
So 2 questions. One, do you have to have been up to giving birth to do that procedure? Can someone who just feels like it's just not tight enough do that without being
Yes, I mean, yes, you can. It would depend on, why is there that change, right? Is it because she's had a larger partner? Is it because she likes toys and she uses larger toys? But sometimes we have non-invasive procedures to do tightening. This is called Thermiva, and this is a device. It's like a hot stone massage on the inside of the vagina. It warms it up and causes the vagina to tighten. It also improves collagen, elastin, and new blood vessel growth so that it can help with lubrication. It can rid the patient of urge incontinence, stress incontinence, make things just a little bit tighter. But this is a non-invasive way, and this might be what would be sufficient for a woman who hasn't had children yet. But
So
that
how
would
long
probably
so how long does that last? Like, so if I got the non-invasive procedure, how long would that last before I need to get another one?
Yeah, non-invasive procedures generally last about a year. And this procedure is done in 3 steps. We do one treatment each month for 3 consecutive months, and then the next treatment is a year after that, if you choose to.
Okay. And then for the surgical procedure, is that once you get it, it's a one and done? You don't need it again, or is something?
Yeah,
you
that's
have
the
to get
whole
done?
idea without the surgical procedure is that it's a one and done. There's a couple things we can't prevent is aging and gravity, right? So those things will change and cause the operation to be less successful over time. But we remedy this. We try to fight this, combat this by a couple ways. One is I will give all my patients a PeriFit device, which is a handheld pelvic floor physical therapy at home. Put it in the vagina. It connects to your phone or another device of your choice, and it has different games that you perform by doing Kegels. So you're able to have handheld pelvic floor physical therapy. The next important thing prior to that is a visit to a pelvic floor therapist. I work with one closely, and we try to get you in with the pelvic floor physical therapist to make sure that you're contracting your muscles appropriately, that you're doing the Kegels appropriately. And with that, you have knowledge, and with knowledge, you have power, and now you've had the procedure, and hopefully it'll be life-lasting despite those things that we can't control, which are gravity and age.
Okay. So after someone has the procedure, what is the downtime between, I guess, what is the healing phase before they can have sex again? So how long do they have to heal before sex?
Yeah, so 6 to 8 weeks before you can have sex, like having a baby. But I will tell you that the first 3 days are difficult. They're hard. I'm bringing muscles together. Those
Okay,
3
so it
days, you need to
hurts.
be at home. Yes, and
Okay.
yes, you need to be at home. Don't plan on going anywhere. We'll give you medications to help with the causes of pain rather than trying to change your perception of pain. So we'll give you specific medications to help with that, but the first 3 days are hard. I generally ask my patients to stay home for a week, 5 days at least. After that first week, you'll be able to move around and walk around and do things that you normally do, but you'll be moving at a much slower rate than you normally would. And if someone knows you, they might say, "Girl, you're walking a little funny." They might notice that. But at that 2-week mark, you can move around, people won't notice. It's not until about 3.5, 4 weeks that you can do some exercise. And that exercise would be modest cardio that you could do. At about 3.5, 4 weeks, self-pleasuring is okay. Um, and yeah, and then at 4 weeks, you can do all exercises that you want with the exception of kettlebell squats, lunges, and squatting, because that drives right where we worked on. So we like to avoid that all the way until the fibrous scar is strong, which is about 8 weeks. And then we can go ahead and do those things. Now, the other part that a lot of people don't discuss is that you need rapid recovery after vaginoplasty. And so we have separate exercises to help you to soften the scar, to be more confident, so that when you see your partner's erect penis coming at you, you're not scared. You can kind of lean into it. You know what I mean? So that's kind of how we do it here.
Okay, so question. So do you also do labiaplasty?
Yeah, of course, we do labiaplasty. There's not much that I can't do to the vulva. There really isn't. I mean, I do labiaplasty, fat transfer, fillers. I mean, there's a whole host of things that we can do.
So we want to talk about the fat transfer because I'm curious. Okay, so labiaplasty. So there was a whole thing about labiaplasty a couple years ago in the news. I think some celebrity had it or something, and people were talking about it. And it's like it's designer pussies,
Huh?
or people are nothing's particularly wrong with their vulva. It's not causing them any pain or anything. They just don't like what it looks like.
That's one group of women. Yes.
So the article I was reading was saying that these people just wanted to look a certain way, so they were going into getting their labia like this, how they see it in porn, which is pretty much like a princess style vulva. So what do you see? So you said that's one group of subset of people. So what are the others?
Yeah, so what I find is that a lot of people who aren't extremely well educated, and that's why we're talking about this, think that, hey, we're just doing this for vanity reasons, right? And that's not the case. There's a number of reasons why a woman may choose to have a labiaplasty. Number one, things get in the way. When she goes to sit down, it's uncomfortable. You know that seam in the middle of your jeans in the back? That
Yes.
can press very hard on the labia. If she is exercising or a cross trainer and the labia are long, there's a lot of friction. If there's a lot of labia, when she urinates, the labia get hit with urine. Then she has to wipe with paper towels. And then if she's doing that on average, like most people, 4 to 6 times a day, she can have hygienic problems, meaning the labia be covered with toilet paper. She can kind of smell of urine at the end of the day. So then what happens if you're experiencing that? Now you're talking about you're in the bedroom. Now he wants to or she wants to go down on you. But you're thinking in your mind, I smell like pee just 30 minutes ago every day because I have long labia. I don't want to do that, right? Or every time I try to have intercourse, I got to kind of rearrange, move things. Hold up. That's hurting. Stop. So there's a lot of things. I want to put on some nice lingerie for myself and feel that sexiness. And I go to look and bloop, something's falling out that I don't want to fall out. So these things, if you fix them, removes things and pressure from the mind, which allows us to thrive and improve. As you know, sex brings so many wonderful things to us.
It does.
So if you're no longer worrying about smelling like urine or worried about pulling on things or pain or lip slips or these kind of things, imagine how much freedom that you have to be more creative, more career-oriented it may be, or to exercise more, or to spend more time and turn on the lights and do more things that you would love to do with your partner because now this is removed. Now, the other side of it is some women, I just want my labia to look a certain way. Well, some women, what's wrong with that? That would be the question. If it is hers and she would like it to look a certain way, and we're both agreeing that sex brings so many wonderful things and it makes her feel better, well, why wouldn't she want to? Why couldn't she do that? Right?
Right.
So we're kind of, when we say you shouldn't be doing that, we're invoking our thought process, our experiences onto somebody else, which is incorrect. I can understand the frustration that some people might experience because there are some limitations. For example, our educational system, when we educate our men and women about sex in their former years, we don't show them all the different sizes that labia can come in and that they're normal. I tell every woman that comes to see me, you're normal as the way you are. You understand that, right? And she says, yes, but I want to change it because I want to feel better about the things that we just talked about, correct? So what I think that we need to do, and I'm saying this as a compassionate, forward-thinking, and a leader in the field, that we need to start thinking a little bit differently about this, and we need to start protecting our women. There are a lot of doctors that are doing these procedures that haven't been trained. They don't know how to do it. They think they know how to do it. They think they are, in fact, a great surgeon. But there's a lot of nuances and intricacies that are involved with labiaplasty that a lot of people don't know how to do. There's
So if some,
also, go ahead.
so if someone was interested in labiaplasty, how would they vet the right doctor?
Well, the way I would vet is, one, you find the doctor you want. She looks wonderful. You like her. You feel like you can communicate with her. Then the next thing I do is go look at her website, and I want to see, does she have any information on there about labiaplasty? Next, I want to see, does she even have a page on before and afters? Are there at least 15, if not 20 before and afters on there to let you know that she's run into some issues and had to correct some things? After you've done 20 or so, you learn a little bit, so that would be helpful. The other thing is, when you're in person, you might want to say, well, where did you train? There's only a few places that you can train here in the United States by bona fide trainers. Those bona fide trainers are Red Allenside, Marco Pelosi, Troy Halparn, myself. And if you can, and if they can tell you they've been trained by that, that means they have at least come in, seen the procedure live. They've seen the doctor work. They've been able to ask questions. They now have someone that, if your case that you're going to go see that doctor is more difficult than that physician thought, they could call me and say, Doc Reed, this was a little bit harder. What would you suggest, right? So what we need to do is start advocating for women's ability to choose, and then having someone there who knows what the hell they're doing.
That's important.
Right? That's what we need to protect our women, to protect all women, but it's not truly out there. And the one way you can begin to kind of identify those doctors is looking for those ones that call themselves cosmetic gynecologists. So in order to become a cosmetic gynecologist, you needed to get more education. And to get that more education, you had to use time. And the most precious commodity that anybody could give is time. And so if a cosmetic gynecologist is giving time and calling themselves a cosmetic gynecologist, they are wanting to be warriors for women, to change women's sexual health and the landscape for women. So that's my 2 cents there.
So you had mentioned something about fat transfers. So what in the world is a fat transfer? What would I be getting transferred fat from, to where? What is
Sure.
that? Is that like a vagina BBL? What is that?
I like that. Vagina BBL.
BBL.
So let's look at the vulva. There's a couple things that happen. There's 2 groups that want to have labia puffing. When you talk about labiaplasty, in general, you're talking about the labia minora, but labia majora can also be modified to your liking. So what happens is, usually it's the 40 fit women given up. They've done having children. Their children are much older. They now can spend some time getting back what they want. They're exercising. They look great, but then they're feeling that their majoras are a little saggy and hanging down. So then you could take fat from the inner thigh. You could take a little fat from the saddlebag, and then you could put this back in here and fill this up and make it more plump like it once was. Or you can actually do like a facelift to the labia majora, where you actually take out some of the skin and then pull it and make it tighter and make the skin tighter. I mean, when you, I was fat, you know what I'm saying? And when you fat, and then you lose some weight, you don't want to see the fat, right?
Correct.
It may not bug anybody else, but it sure bugs you. It bugged me.
Right.
I went and got it cut off. I mean, it's the same kind of thing. And that's the thing that I think that we need to get to, is understanding that there are truly some functional reasons that people are getting these procedures done. Let's not bother them as to why they're getting it done, but let's start protecting them and advocating for them and making sure that the physicians that are saying that they're experts at all of this truly are experts and not hurting women. I mean, so many women are botched,
Yeah.
meaning they have labia that are completely amputated on one side and another sticking
Jeez.
out like this, and the hood is over here. And they went in with the ideas, I'm going to have freedom. I'm not going to have lip slips. I'm going to be able to wear what I want. I'm not going to smell like pee. And then you have all of this. We need to get trained. That hurts.
Yeah.
I believe in it. I told you I have a training institute. I also help spearhead a procedure where we help women who have been botched. I actually do a vaginal flap advancement where I can create new labia for women that have been completely amputated. I can bring that back. So there's a lot of things out there. I think it's time that we protect our women, get these doctors to do better. Don't use YouTube to try to figure out how to do labiaplasty and vaginoplasty. And let's get these people trained, and let's get these women protected, and let's change the landscape for women when it comes to women's sexual health, because it ain't been touched in about a decade or more, right?
Yeah. Yeah.
Well, men have and had it forever. You got Viagra, you got testosterone. I just told you what I did.
Yeah.
That was what, 16 years? No, not that long. 10 years ago or so. And we
Okay.
just now talking about it for women.
Yeah, because I didn't know. I didn't know that yeah, with the whole fat transfer, that was totally new to me. I've heard of all the other things, but I didn't know fat people were concerned enough or cared enough about their bowl
Well,
drooping that they would get.
there's a few areas that affect how we feel in the bed.
True,
Our
true.
nose, right? That's why a lot of people get rhinoplasty. Our nose affects how we feel in bed. Our breasts do affect our sexual abdominals, our belly, and our genitalia. Those are the main areas. So we've just went from nose to breast and now we get to really
Yeah.
hit this one.
I ne
Yes.
I never thought about your nose affects your sex life. I've
Yeah.
never like I was like, this is the nose I got. Like you either like it or you don't. It's just what it is. So in closing, tell me how you feel that cosmetic gynecology, give me 3 ways how it affects women's sex life for the better.
How it affects women's sex life. That's easy. So number one, you have a physician who is going to listen and is going to advocate on your behalf to achieve the goal that you want, whether that is more lubrication, whether that's to stop leaking, whether that is to stop having painful sex, or whether that's to be a little tighter and get a little bit more grip, or that's to not have things dangle and jangle, and I want to pull it in and tighten it to make it look like I look everywhere else. I think those are several reasons. That's one good reason. Another good reason that you would want to seek a cosmetic gynecologist is that we're educated in hormone replacement therapy. We can help you with your hormones. We can help you understand what's right, what's wrong, why it's okay to take estrogen, why it's okay to take vaginal estradiol, and why all of these things can improve not only your health, but it can also improve your sex life. Last reason you would want to find and see a cosmetic gynecologist is we can do your regular GYN stuff too. We're knowledgeable in everything. I mean, I still know all of this stuff. I mean, it ain't like it's gone just because of the last several years. I mean, I've been practicing OBGYN for 25 years. I mean, there it is. I mean, why not?
You get everything done in one place. So if someone was interested in getting a procedure done, how can they find you? Where are you located, and then how can they find you?
So I'm located, I have 2 offices. I have an office in Davis, California. You can also get me in Beverly Hills, California, 9720 Wilshire Boulevard. I'm also in Davis, California, which is about 14 miles east of Sacramento. If you'd like to see some of the procedures and how we do them, you can go to my YouTube channel. Just punch in there, Dr. Michael Reed. If you want to hear me and see me on a day-to-day basis, you can go to Instagram, TikTok, Facebook, any of the platforms. I'm there too. And my website, hit me up there. I'm on Real Self. There's not
What
too
is
many
your
places you
website?
can't fight. Dr. Michael Reed, or the cosmetic gynecologist, the GYN. Either any or all of those ways, you'll be able to find me.
Well, Dr. Reed, thank you. This was a very enlightening conversation. I learned something that,
Well, that's good.
I
That's
might
good because I
be,
saw your stuff and you know your whoop, 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 whoop. I looked through your. You had me a little nervous. I had to. I'm ready.
I don't know this. Like, I don't know anything about getting vaginal surgeries. So I was here to learn and to learn something new, and I did. And, and I might be interested in something.
Yeah. Call me. I'm here.
I'm on the way to Atlanta.
I'm always here. Hey, I have patients. I would say 60% of my patients come from out of state. They all fly in. My hotel that we keep them at is 200 feet away from my office.
Because I was getting ready to ask, well, how does that work? Like with the recovery time? How long? If I'm out of state, how long do I have to stay at a hotel?
Depends on what you're doing. Depends on what you're doing, right? So if you're doing a labiaplasty and you're flying in from Atlanta, I would just say you need to stay probably 24 to 48 hours. I would say 48 to 72 hours. If you're getting a vaginoplasty, vaginal tightening, you definitely don't want to leave for 4 days. 4 days, because those first 3 days are really difficult. And so
I'm not gonna lie. The first 3 days is very difficult. It has to be worried. Like it's probably like on a scale of 1 to 10, it's probably a 10. It's probably horrible, isn't it?
No, they don't. Nobody ever is a 10. I've never had anyone say it's a 10. Nope. I've never had anybody say it's an 8. I've had them say it's a 5, 6, and 5 and 6. That's hard for some. But again, I have medications that help with the muscles, the nerves, the inflammation. So we're trying to help you with the causes of pain, than really trying to change your perception of pain by just throwing Vicodin at you. That's not what we do.
Okay. Well, thank you, Dr. Reed.
Yeah, well, thank you for having me. It is an honor and a pleasure. Enjoy your Instagram, and to be here and speak on your platform is an honor. And thank you for having me. And the last thing I want to say is, I love your glasses. You always got something going on with them glasses.
Thank you.